Hi, I'm Igor, and today we will go talk about cardiac tumors. Cardiac tumors is abnormal cell growth from mass in heart. Types is classified on primary and secondary. Primary rare, adult myxoma and children rhabdomyoma. Secondary more common than primary. Metastasis from cancer in other areas, for example, lung cancer, lymphoma, breast cancer, leukemia, melanoma, hepatocellular carcinoma, and colon cancer. Lymphogenous and hematogenous dissemination. Complication. Impaired left ventricular structure, filling ejection caused by tumor. Erythemas. Tumor disrupts normal nodal septal electrical conduction. Heart failure. Tumor obstructs inflow and outflow. Recurrence of tumor after excision if tumor not completely removed. Embolism, sudden cardiac death, and myocardial infarction. Signs and symptoms. Asymptomatic. Incidental finding on echocardiogram, MRI, CT scan. Dyspnea. Most common symptoms. Can progress to orthopnea, paroxysmal nocturnal dyspnea. Tumor plop, sound upon auscultation with left atrial myxoma. Syncope, presyncope, dizziness, chest pain, and tightness. Diagnostic imaging is MRI, CT scan, and ultrasound. Incidental finding. See individual's disorder to the echocardiogram prefer procedure. Diagnosis lab result histology conducted on biopsy with surgical excision by needle aspiration. Treatment is surgical symptomatic surgical resection. Other intervention is symptomatic monitoring this disease. We see on this slide atrial myxoma, the most common primary tumor known to produce vessel endothelial growth factor. Atrial myxoma also. Atrial myxoma is a benign heart tumor, most common primary cardiac tumor in adults, arising heart mesenchymal connective tissue, most common in left atrium, may cause syncope, tumor in left atrium, obstruct mitral valve, histology, pedunculated attached to tissue stalk, gelatinous due to abundance of ground substances. Risk factors is occur in patient between 40 to 60 years of age, more common in biological females, less pronounced in familial atrial myxoma, genetic disease. Signs is also is maybe asymptomatic, is incidental finding on echocardiogram, MRI, CT scan, dyspnea, most common symptoms. Is lab result is histology, stellate myxoma cell in myxoid tumor, stroma of lichens. Treatment is surgery, resection, asymptomatic monitor. Rhabdomyoma is benign tumor of striated muscle, most common primary cardiac tumor in infants and children, arise in ventricles, present congenitally, benign hamartoma, abnormal tissue formation, association between rhabdomyoma and tuberous sclerosis about 30 to 50%, often regress spontaneously, shrink with age. Risk factors for this disease is more common in children, more common in biological males, 2.4 to 1 male-female ratio. Average presentation age is 4-year-old. Associated with nevoid basal cell carcinoma syndrome and genetic disease. Signs and symptoms usually present at birth. Tender, painful, benign, slow-growing nodules, commonly in neck, mouth, and larynx, make case breathing difficulties. Diagnosis is MRI, CT scan, ultrasound is incidental finding. Also as atrial myxoma, ultrasound, MRI visualized tumor. Treatment symptomatic is surgical resection. Asymptomatic monitor of this disease. Lab result histology hamartoma cells grow surrounded in a glycogen-rich eosinophilic cytoplasm. Is It is rhabdomyoma, tumor of the striated muscle, and it is a biopsy of this disease. Thank you. Subscribe to the channel.